So the guy behind me, William Shakespeare, gives you kind of clue where we are today. My name is Dr. Hugo Kitchen. I am the clinical director of the Stratford Dermatherapy Clinic, and I'm going to show you today about one or two of the procedures that we can perform to treat some of the most hideous parts of your body, bits that really upset you and worry you. So if you want to follow me, we'll go and have a look. I'm going to talk to you briefly about one of the most popular treatments that we do at the Stratford Dermatherapy Clinic, and people are very keen on body image and how they look, and one of the features that we've noticed in recent years is the obesity epidemic. Now, Falstaff, one of our favourite sons, used to love his chicken and his beef and his bread and everything and loads of wine. This is kind of one of the typical tummies that we might get in, and people aren't sure what they can do about it. Now, we have a treatment called Vaser liposelection and another one called body jet. They remove the fat. We would like to be able to trim him down by 2 or 3 inches around the waist. So traditionally, what we take out has normally gone in the dustbin, but now we are going to use that fat that we've taken out for an even better treatment. Fat is going to become the new filler. Now here we have one of our Stratford's most hideous daughters, Lady Macbeth. She was a mean woman and she was rather wizened and frightening. Now, if we just go up to her face here, you'll notice that while she has high cheekbones, she has lost some volume in the mid-face here. So when I was talking to you about Falstaff earlier, one of the things that we can do now is fat transfer. We take fat out of your tummy or your hips or your thighs. We can put it in a syringe and we can inject it back to recreate those lovely rosy apples the Renaissance artists loved to paint. Another area. We do a lot of aesthetic work on people's faces. We try to make them look younger and more beautiful. And then suddenly they put the aging hand up to their face and people say, ah, now I really know how old you are. So what you see in the aging hand is the web spaces between the fingers showing the tendons and the blood vessels coming through. So, as you can see, Lady Macbeth, not a young girl, she's got these deep web spaces. We could take some fat out of her tummy, her own fat, she can't reject it, and we could inject it down the back of the hand to plump the back of the hand up. This would make it look 10, 20 years younger.
I've had a few patients, very specialised needs and have wanted penile enlargements, and it really does affect their lives at the end of the day. And there are certainly a couple of procedures that can be done, one of which is less invasive, which is fat transfer actually, and you know, it can involve several treatments, but certainly can get the results that they're after. But of course we have a specialist surgeon that actually comes over from Italy to do that, and actually then, you know, they can actually resolve their problems and issues and dramatically psychologically also change them as well actually.
The inner arm and above the knee, which I know seems a strange area, but it's a really common problem for ladies because they're keeping themselves in shape now, and what's happening in the skin on the upper knee is starting to get loose, it's starting to drop. So what we've got is a great new treatment called Pelave, which is over from the States. It's FDA approved, it works on radio frequency and it helps to tighten the skin. So you'll get that firming effect around the knee area. But then I combine that as well with Restylane Vital, which is pure hyaluronic acid, which then adds volume to the area. And the two together, you know, get a great result. They've now got the firming from the radio frequency and they got the plumping from the hyaluronic acid from the Restylane.
When you have a smile designed for you, often when the new smile is fitted, patients are apprehensive of how it will look. And that smile is going to be with them for many years of their life. So it needs to be perfect for them. So we provide them what we call a trial smile. So the trial smile is what we create artistically within our practice. We spend a lot of time, a lot of passion, a lot of energy in making it look superb. So that they can try it out for about a week and they come back and give us feedback on how it looks. And they comment on the size, the shape, the texture, the color, the luster. And we may modify this, and we use this almost as a template prior to the final smile being delivered.
Is it a mould that you make, or you actually put on veneers, and they can obviously be taken out quite easily?
Absolutely, it's something that we custom make, not via a mould, but I actually hand make each tooth for each patient and their smile, depending on their characteristic, their charisma, the face, exactly what they want.